morning class. So today's my topic is asepsis and the skills reinforcement. So just imagine the patient comes to you for the wound dressing, but he will get the hospital acquired infection. This will be prevented or not? He just came for the wound dressing and he gets a hospital acquired infection. It can be prevented. So this is prevented by aseptic techniques. Okay. In our healthcare, treatment is not just a saving life. It is to prevent infection also. So that's why we need a asepsis and aseptic techniques. Okay. So introduction. Aseptic means what? Asepsis means what? Absence of disease causing microorganisms. Okay. So the organisms which are causing diseases, it can be eliminated and reduce the infection. Aseptic practice is preventing infection and contamination. It is an important part of our nursing care. Okay, it helps to maintain the safe environment for patients and healthcare workers. It is essential in hospitals, clinics, and or community health settings. What is the definition of asepsis? Asepsis is the condition of being free from harmful microorganisms. It refers to the methods used to prevent the contamination by the pathogens. Asepsis is the practice of keeping area clean and sterile. So, what are the types of asepsis? Medical asepsis and surgical asepsis. What is the meaning of medical asepsis? Means just a reduction of the microorganisms, not all. And what is surgical asepsis? These are the sterile techniques, means killing of all the microorganisms, okay, including their spores also. So, what are the examples of medical asepsis? Hand washing, cleaning of equipments, using of gloves, bed making, and waste disposal. That is our clean techniques. And what included in surgical asepsis? Dressing changes, catheterization, injection preparation, minor surgeries, and OTs. You see, there is all invasive procedures are included in the surgical asepsis. All our clean techniques are in the medical asepsis. So just repeat it. What are the types? Medical asepsis and
surgical asepsis.
What is medical asepsis?
Clean techniques.
Clean techniques. What are the examples of medical asepsis?
Bed making, hand washing.
Bed making. Okay. And what is surgical asepsis?
Sterile.
Sterile techniques. What are the examples of sterile
Catheterization, minor procedures.
Okay. More?
OT.
In OTs, operation theaters. So next is, what are the principles of asepsis? Medical asepsis principles. Just right now I told you, these are the clean techniques. Wash hands before and after the patients. Hand hygiene is both common in medical asepsis and surgical asepsis, but there is a difference between the timing of the hand washing. In medical asepsis we use 1 to 2 minutes hand wash is there in medical asepsis, and 3 to 5 minutes hand washing in the surgical asepsis before any invasive procedure. Other principles are use personal PPEs when needed. Okay, PPEs for self-protection. Clean from the least contaminated to most contaminated area. In surgical asepsis, from more contamination to less contamination. Dispose of waste properly in the medical asepsis. Avoid touching contaminated surface and maintain personal hygiene. These are the principles of medical asepsis. In surgical asepsis, only sterile touches sterile. Means when the person is sterile, then he can touch to sterile portion or sterile area. If sterility is doubtful, it is considered as unclean or contaminated. Keep the sterile items above the waist level, okay, above the waist level, and the sterile portion is there. If 1 meter from the 1 inch of the sterile field is considered as contaminated. Last one is minimizing the talking, coughing, and sneezing over the sterile field. These are the principles of surgical asepsis. So what are the principles? Medical asepsis, hand washing. What's the time of hand washing?
1 to 2 minutes.
And okay, PPE, personal protection. And in surgical asepsis?
3 to 5 minutes. And
okay.
1 inch
sterile,
sterile.
1 inch sterile field is contaminated. Do not sneeze, cough, and talk on the sterile field. Okay. What are the importance of asepsis? To prevent complications of the patient. And more?
Hospital acquired infection.
Hospital acquired infections, right. Prevents hospital acquired infection, prevent cross infections, promotes faster healing, reduce complications, and protect healthcare workers and patient also, both. Improves quality of nursing care. These are the importance of asepsis. What is the role of nurse in the aseptic techniques? Proper hand washing, right? Okay, yes, please contribute. Health education to the patient. Follow infection control policies. What are the infection control policies? CLAPC,